Hi, welcome to this week's episode of Ask Dr. Jessica. We've got a great guest today, Dr. Carl Fleisher. Hi, Carl.
Hi there.
Carl is not only has he been a good friend to me, but he's also a phenomenal child psychiatrist. Carl works at the university setting, and he also works in private practice. And tell us more, tell us about being a child psychiatrist. I know there are not that many of you out there.
Oh yeah, I just was writing about this because my daughter's school has a career day coming up, so I'm gonna talk with the middle school and high schoolers about it. But I have a job that I love. I get to talk with kids and play with kids, so sort of like being a pediatrician, you get to stay young, spending all your time with kids. And I talk about real things, important things that are going on in their lives. And so we talk about school and friends, and for high schoolers, we talk about some other subjects. And then I talk with parents about real struggles of parenting, and I can definitely empathize being a parent myself with most of those. And so it's great to be able to talk with folks about that stuff, and then to be able to make a difference. The kids' problems really do get better, and that's always really gratifying.
Now, Carl, how did you end up being a child psychiatrist? Was there any influence in your life, or what do you think gravitated you towards child psychiatry?
Yeah, great question. In hindsight, I think it looks like a straight line. I was interested in kind of people and behavior early on. So in high school, I took AP psychology, and then in college, I was a psych major. And at that point, I sort of fiddled with the idea of going to grad school and being a psychologist. But a big influence in my life was my parents, who were pediatricians, and my grandfather as well. And so they did their darndest to get me into pediatrics, which they didn't accomplish, but they did at least get me into medicine. And so I decided to go to med school instead of grad school. And when I went to med school, I was pretty much certain by then that I was going to do psychiatry. And I ended up loving actually seeing patients, which I hadn't been able to do as a college student. And so I'm very lucky to have a job that I really love.
That's great. That's great. And I know, and just so people that are listening out there know how much training you went through. After you go through 4 years of psychiatry residency, you do an additional training for child psychiatry, correct?
Yeah, an additional 2 years. And so it's overall 6 years after medical school.
And do you happen to know how many child psychiatrists there are in America?
Roughly 7 or 8 thousand.
That's
Yeah.
not very many.
No, for roughly I think I don't know, like 70 or 75 million kids under 18.
Wow.
Hmm.
It makes it
Yeah.
tricky. I'm just thinking about how many kids out there are looking for help, and I'm sure it makes it tricky to find good help with so few child psychiatrists.
It is, yeah. That's one of the somewhat intractable problems that we face. But I think the silver lining of COVID, of the pandemic, has been that for people who have no child psychiatrist in their immediate area, or even for 100 miles, then if they live in the state of California, they can consult with me. Or if they're in a different state, they can consult with whichever child psychiatrist is in a bigger metro area.
Okay, so tell me, what are some of the most common issues that you take care of or that you treat? Are there...
Yeah, great question. Definitely the number one most common issue is anxiety. That's just the most common issue for kids. Probably somewhere around 10% of kids struggle with significant anxiety, so an anxiety disorder, uh, particularly before puberty, only because depression tends to overtake anxiety after puberty.
Interesting. Okay.
Mhm.
So anxiety followed by depression, and then any other common
Yeah,
conditions that you
after
treat?
that, probably ADHD is one of the most common things that I see. ADHD is probably somewhere around 5% of the population in developed countries. And so, out of 20 kids in a classroom, right, that's a significant chunk.
Yes,
Mhm.
absolutely. All right, so maybe let's start talking then about anxiety,
Mhm.
just because so many of us out there have anxiety to some degree, and I do think it's hard for parents to know what to do when they see anxiety in their children. They want to know some first steps, how to handle it, how to treat it. Do you have any general thoughts out there for parents when they notice their children are having anxiety?
Yeah, definitely. And pretty much the first thing I talk about with parents and with older kids is recognizing the difference between anxiety, the emotion, which is healthy, that we all have at various points, that protects us from danger, right? So when we're crossing a street, we should be nervous enough, at least, to look both ways, right?
Right.
And then unhealthy anxiety or excessive anxiety. And there's sort of a quick rule that I use to distinguish between the two. One is pretty obvious to everybody, that there's some things that kids can worry about that nobody should be worried about. And so like a phobia might be a good example of that. You could have a phobia of spiders. Well, people, feel nervous around spiders, but you could have a phobia of dogs. And for the most part, there's no particular reason to feel really scared or terrified of dogs. And so everybody can kind of recognize like, oh, you're not supposed to be anxious about that. And so that's an unhealthy or excessive anxiety. It may not cause a big enough problem that it needs treatment, actually, but at least we can recognize, okay, that's not supposed to be there. And then the second piece, which is sometimes more subtle, is excessive amounts of anxiety about something that would make anybody nervous. So flying could make people nervous. There inherently is some risk, but some people are so fearful about flying that they can't do it, or even talking about an airplane or an airport would be hard for them. And so that's how we distinguish unhealthy from healthy anxiety. And then if it's interfering with a kid's life, with their progress in school, or the other job that kids have is to play and have fun. So if it's interfering with their ability to have fun, then that makes it enough of an excessive anxiety that somebody should be talking to that kid about it and help them make it better.
And when parents notice that their children have crossed that line where it's becoming in the way of their life, do you think a next best step would be to see a psychiatrist or a psychologist? I mean, I think people out there are confused the difference between the two.
Mm-hmm.
Can you maybe explain that a little bit more?
Of course, yeah. So psychiatrists go to medical school and they can prescribe medicine. They may do many similar things to what psychologists do, but fundamentally that's the difference. Psychologists or therapists of other stripes go to graduate programs to get a PhD or master's, what have you, and they get a lot of good training about helping kids talk through problems. And a lot of problems can be solved that way, but they can't prescribe medicine. There are a few states where psychologists can prescribe because of a shortage of psychiatrists, but by and large, that's the difference.
So I think a big question that comes up, if I recommend a psychiatrist to families, a lot of them get nervous that I'm then suggesting their child be on medication. And I'm sure this comes up with you, but there's a lot of question marks around medication for anxiety and depression, in terms of will their child be on it forever? Does this mean they're going to have be made fun of from their friends or thought of differently? I'd love for you to kind of talk about what you usually see when children come to your office and these questions come up.
No, happy to. And I was going to mention before, so parents should start with a therapist, with a psychologist. I wish I could say start with a psychiatrist, but there just plain aren't enough psychiatrists anywhere for that to be the starting point. So a lot of the patients that I see, they get referred to me by their therapist, essentially. The therapist tells the parent, hey, I think there's something else going on here. Let's get somebody else involved to take a look. And, so parents, are fearful to bring their kids to a psychiatrist for good reasons. But I always tell parents, my job is to make sure that kids who shouldn't be on medicine don't get medicine. My job is to screen kids out, really. And the kids who get medicine, the only reason I would prescribe them medicine is because they absolutely need it, because we've tried everything else. And that's the last stone that we're going to turn over. And so oftentimes I see kids and I say, okay, this definitely is something that we should work on, but there are these 4 other stones that we want to turn over first. If you turn those over and it's not working, then come back to me and we'll do the last one.
So if a family comes to you and sees you, it doesn't mean they're going to leave with a prescription.
No, no.
Okay.
Oftentimes, families, by the time they see me, they have tried everything else because they were so worried about what would happen when they see me. And so, certainly, a number of families I see, I say, look, yeah, at this point in the road, medicine is the last option and a good option, right? We only use tools that we think are going to work. But when it's an effective tool and a safe tool, and we've tried the other tools that we wish would have worked, then yeah, I do often end up seeing kids who need medicine for that reason.
Now, what about for families that are worried their children are going to be on a medication forever? I think a lot of us fear in the back of our mind, oh my goodness, if we start this medication, are we looking at a lifetime of being on, psychiatric medications, antidepressants, anti-anxiety medications? What do you see in your experience? If a child's on one of these medications, are they on it long term, or can it be short term?
It can be short term, and that should be the goal from the beginning. So almost every parent I see expresses that worry to me, and I say, absolutely not. Because if I were any kind of doctor offering something supposedly as a treatment, and I said, you're going to need this treatment for the rest of your life, it wouldn't be a very good treatment. If you have type 1 diabetes and your body does not produce insulin and you can't survive without insulin, then yeah, that's a treatment that you're going to need for the rest of your life, right? Unless there's a pancreatic transplant that we can do. But we're not replacing something that kids can't live without, that they'll never be able to do on their own. So, we've got essentially an injury in the brain where the brain's activity is not the way it should be. And we want to repair that injury, more similar to the way that a broken bone can get repaired. It can sometimes heal itself, but sometimes it needs a little bit of extra help. And so we put it in a boot or a cast or occasionally a surgery, and then let the healing process continue on its own. So I tell parents, medicine is something that's going to make your kid better. If it's not helping, then we're not going to keep doing it. But if it's helping make your kid better, then the problem should be actually getting fixed and the kid should heal. And then we should be able to take away the treatment because the healing is done.
I know a lot of people fear that their child will be on a medication for the long term. So I think it's nice that in your experience, you see that's not necessarily the case.
No. I mean, ADHD is sort of in the gray area there because it can get better over time as kids become adults. And so there's certainly kids with ADHD who take medicine for a number of years or even most of their childhood. But even then, we expect that as adults, many of them will not rely on medicine. And each year is a different year. So a kid may take medicine in third grade and then not again until sixth grade and then not again until ninth grade, depending on just what the needs of the school year are. And parents always have the option to say, not right now.
It's true. They do have the option to say no. And so what about the idea that children will be, I think a lot of parents fear that their kids will become dependent on it or, get used to it, or that they won't act like. A lot of fear I hear is they're worried that their personality will be different, that they won't be themselves. Is that true?
Yeah. No, fortunately. Yeah, medicine's not nearly as powerful as people worry it is. And that's a good thing. Sometimes I wish it were that powerful that we could make some of these changes, but it's just not nearly going to have that much effect. So it doesn't change people's personality. There can be side effects while you're taking medicine. And I always tell kids and parents, the goal is that you have zero side effects. If you take medicine, it causes side effects, you stop taking it. And then you're done. They go away.
And what are the most common side effects that you notice if a child's on an anti-anxiety medication?
So the side effects there that we see are sometimes there are some physical side effects. So kids could get headache or lightheadedness. Sometimes they have some stomach discomfort, relatively minor things. And oftentimes even side effects will go away. So they're only present for a few days or a week, and then they're gone after that. Okay. There can be emotional side effects. So as kids get to be teenagers, or for parents, what sometimes we worry about is that there could be not personality changes, but emotional changes that can happen. And it can happen where kids feel more numbed out emotionally. They feel like they're not having any feelings. So the excessive emotions are gone, but none of the regular emotions are there either. And that is a recognized side effect of medicine. And if it happens, we stop the medicine, side effect goes away, and then we reapproach the problem from a different angle.
Okay. Parents that are looking for, quote unquote, more natural alternatives.
Hmm.
I've had some parents recently ask me about my thoughts on THC or CBD for children. Other supplements I get asked a lot about are St. John's Wort.
Hmm.
Um, is there any evidence that any of these supplements out there are helpful for children in terms of anxiety or depression?
Yeah, great question. So St. John's wort, yes, actually, St. John's wort and ginkgo biloba are two medicines that affect the serotonin system in the brain, which is kind of the confidence, happiness system, and that's how some of the medicines work as well in treating depression or anxiety. So those things actually could work, and we would only do one or the other. We would either do medicine or a supplement like that, but not both, because they would not combine safely. Other than those two, though, there's no evidence that anything particularly helps. Oftentimes, parents want to try things, and I say, "Great, go right ahead and try it." I still have a job, so I'm pretty sure these things don't work that much. But if they work for one kid, great. And if that's one less kid who takes medicine, totally fine. Sometimes I actually recommend other things that fall outside sort of traditional medicine, like acupuncture, if kids are open to it. Or even kids who aren't getting exercise, I say, well, okay, well, why don't we try getting exercise first and see how far that gets you, especially coming out of COVID where kids were so inactive. Sometimes we find that makes a difference at least part of the way.
Now, Carl, I have a question just in terms of your approach to therapy. So, kind of backing away from medication for a second. When I know there's a lot of different styles of therapy out there, what what is your method of treatment? So, if somebody comes to you with an anxiety or a phobia, um, how do you approach that in terms of therapy?
Yeah, great question. So anxiety, because it's the most common thing that kids suffer with, there's a lot of research about it. Probably half the research in child mental health is focused on anxiety. And so we know a lot about how anxiety crops up, how it causes problems, and then we know a lot about how to make it better. And it is a treatable illness. So I always tell parents we should expect this to get better. If it's not getting better, then the treatment is wrong rather than something else. So the therapy approach that's been studied the most for kids with anxiety is something called cognitive behavioral therapy, or it goes by the acronym CBT. And it basically is designed around the way anxiety works or fear works in the brain, which is kind of similar to a fire drill. So basically every kid who's ever been to school knows what a fire drill is. And so fire alarm goes off and it's supposed to signal danger. And the way pretty much every kid who's ever been in school responds to a fire alarm is they stop paying attention to the teacher, they chat with their friends, they start lining up at the door, and they gradually saunter out of the building. So there's this danger signal that we have learned to ignore, to not treat as a danger signal. We just treat it as an interruption in our day. And with anxiety, when it's an anxiety disorder, we've got a danger signal that we should be able to ignore, but we can't. And so the cognitive behavioral therapy is really about, number one, teaching kids that paradigm, and then number two, teaching them strategies to actually start to get used to, get accustomed to the danger signal. And the more kids get accustomed to it, actually, the quieter it gets and the less often it bothers them.
Interesting. So, let's say, for example, there's a child who's fearful about taking their mask off. They've been so used to wearing masks. How would you approach a child, just kind of giving a real life scenario?
Mm-hmm.
How would you go about approaching this if they're worried that they take off their mask and they're going to get sick?
Right, right. No, I mean, like a parent could say, I've got a kid, say an 8-year-old, and they won't take their mask off at home after they get home from school. Right? I say, gosh, okay, you should be able to not wear a mask at home. And so you'd want to, again, teach that kid these things about how anxiety, how fear tricks people, traps people, and kids can grasp that. And once they understand that, then you can say, okay, so let's test this out a little bit. Let's actually pull the fire alarm and turn it on. And then let's see if we can react to it differently on purpose. And so you could have the kid say, all right, well, let's undo one of the straps of your mask. We don't even have to take it off. Let's just undo a strap. Yeah. And if you want to hold it in place, you can hold it in place, but just so we know it's not fully on, right? And you could gradually advance from there to say, okay, well, let's then just bring it down. Maybe what if we bring it down over, so it's under your nostrils instead of on top of your nose, right? So we can actually provoke the alarm that way a little bit, very gradually, and then the kid will feel anxious and then actually start to realize, oh, nothing bad is happening. And so you always want them to make that link of there was an alarm, the fire alarm went off, but nothing bad happened. And as long as they can make that association, then they learn that the fire alarm doesn't have to be paid attention to every time.
It's brilliant. Do you find that when you, as a child psychiatrist, that it's important to have the parents involved as well so that they can implement some of these ideas and methods at home?
Yeah, absolutely. In that cognitive behavioral therapy framework, actually, there are some treatment paradigms that actually just teach parents and then have parents do it all at home, and the therapist never meets with the kid. And they have found a fair amount of effectiveness there because parents have so much influence, and also teaching parents that stuff really empowers them to show these things to their kids. And so that could be another way to go about it.
That's great. Because I know if they're only seeing you once a week, that'd be so helpful for parents to help be able to be empowered to help at home. So that's good to hear. Mm-hmm. Do you find there's any themes with children that are anxious? Like, is there any way that we can identify these children early and help in an early way?
Yeah, that's a great question. The forms of anxiety that tend to be the most common are social anxiety, so not just shyness, but really a significant excess of shyness. So kids who are too inhibited to make friends, right, to talk to other kids on the playground or in the lunchroom, what have you. Or generalized anxiety, which is generalized because it's about everything. It's about things that are important, like school, but also things that aren't important, like will I get to the movie I want to go see on time? That can't matter that much that you got to worry about it. So those things, or for younger kids, separation anxiety. A little bit of that is normal, but you can have a separation anxiety disorder where it's really too hard to bring a kid to school or preschool, that kind of thing. And so the quick rule I have for parents is that when kids have normal, healthy anxiety, you should be able to reassure them and the anxiety should go away. I'm worried about this bad thing. Okay, well, I'm a parent. Let me tell you, this bad thing, don't worry about it. Because, okay, unhealthy, excessive anxiety tends to still be there even at no matter how many times you try to reassure a kid. I'm worried you're going to die if I get out of the car and go to school. Don't worry, I'm not going to die. Next day, same worry. So if the same worries are cropping up, no matter how much you reassure a kid, that's something that will probably need treatment.
Okay. Yeah, that the separation anxiety after schools being closed this last year, I've heard from so many parents that have had trouble dropping their children off at school without, having a tantrum or experiencing crying. And I know that some of that is normal given what changes they had in the last year. So I do agree, like some patience is needed, but a lot of parents ask at what point should we be concerned and seek therapy?
Mm-hmm. Yeah, I mean, for me, that question of, when do we actually go see the therapist or the psychiatrist, to me is really more about getting ahead of something rather than saving something until the very last moment. My mom had a rule when she taught me how to drive about headlights. If you're asking yourself the question, is it dark enough that I should turn my headlights on? Then you should turn your headlights on.
Right.
And so I tell parents, if you're asking yourself the question, should we bring our kid to a therapist? Just do it. Bring your kid to a therapist, because the best news you're ever going to hear is, oh, actually, after talking with this kid, you guys don't need my help.
I think some parents worry that if their child sees a psychiatrist, that'll mean, a lifetime of issues, or they'll be labeled with a psychiatric disorder, and that it'll stigmatize them. Mm-hmm. Do you have any reassuring words for anybody listening that, what it's like when families see you, that it, like letting them know what to expect?
Yeah, for sure. And, as I was saying before, my job is to make sure that kids don't take medicine unless they really need it. If every parent who was worried about their kid brought them to a psychiatrist first, psychiatrists would be inundated with kids who don't need prescriptions, and they wouldn't write them. And so that's part of why you need to start with a therapist. But, bringing a kid to see me is a lot like bringing a kid to any other doctor's office. So if it's an in-person visit, you go and there's a waiting room, and then I come into the waiting room and we go back and we talk for a bit. There's no chair, there's no stethoscope, so that stuff is missing. But I talk with kids, I talk with parents. For younger kids, I pretty much talk mostly with parents. For teenagers, I kind of 50-50. And then we work together to arrive at an understanding of what's going on, whether it's anxiety or anything else. And I tell parents, if we understand what's going on, the solutions will be pretty obvious. We can decide that we want to use one solution or another, but we want to at least know what the solutions are. And so most of the effort really is figuring out which problem, if any, do we have.
That's great. Now I'm just thinking about teenagers for a second. I've come across a lot of teenagers that have had some, suffering from anxiety, depression this year in particular. Do you find that teenagers are harder to treat than younger kids? Any thoughts on?
Yeah, they're more complicated because they're sort of mini adults, but not really. Their judgment is definitely not adult judgment. It can be easier to work with teenagers because they'll talk, and little kids don't really talk that much. So they can explain to you what's going on inside of them much more easily than younger kids can. But they face a lot of challenges. It's really hard to be a teenager, no matter when you were a teenager. It's hard. And so we got to try to help them confront the different challenges that they face, and teach them hopefully useful tools to be able to cope with those things. But teenagers, because they can talk about, they're really very gratifying to work with, because when you really help them, then you can really see their lives change.
I think it's hard for parents to recognize what's normal, teenage emotional outbursts versus when to seek therapy. But I like your point about the headlights, because you're right, better to get ahead of it when in doubt.
Yeah, and I mean, the other thing that I would say I see is that I can easily tell parents nothing should be bad every day. There's plenty of normal teenager stuff that happens every once in a while, but if it's every day, that somebody needs to talk to you about that.
That's great. Are there any tips out there for parents that are listening, in terms of how to help their children when they notice emotional, if they notice anxiety, depression, things of that nature? Any tips in general for parents where they can get help, or any advice for them?
Yeah, definitely. I mean, the tips I would think about would be, number one, in terms of talking to your kids. Then I talk to them if you have a concern, share it. Younger kids, again, may not be able to have a conversation with them about it, but you can let them know that you see them struggling or suffering. Or again, maybe you're not sure, but you can ask them. And kids who are really honest, and they may not have as much perspective as we have on the world, but they know themselves pretty well. And they'll tell you if there are challenges they face that they don't know how to find their own way out of, or they do. So talking to kids and just getting their perspective is really important. And then the other piece would be getting a little more information. So long before any parent brings their kid to see a therapist, they're probably Googling this or that other thing, anxiety, depression. There are some resources online that are more accurate and a little more consistent than just whatever you would find on Google. So, for example, I often tell parents to look at a website for a group in New York called the Child Mind Institute. They focus a lot on parent education about mental health, in addition to some of the treatment stuff they do. So their website, childmind.org, I think, is just chock full of really useful, very plain language information about all things child mental health.
It's true, because online, I think a lot of parents, we all look for help online, but we don't know what's a trusted source. So that's a great tidbit.
Exactly, yeah. And then when it comes to psychiatry, child psychiatry, I may be biased, but the National Organization of Child Psychiatrists, which is the American Academy of Child and Adolescent Psychiatry, part of their website, again, is dedicated to educating parents and families. So that's aacap.org, acap.org, has excellent information as well.
But what about parents that want to get their kids in for help and they can't because you guys are full? Do you have any advice for where to actually get help when they call around and there's no one available to see their children?
Hmm. Yeah, yeah. That one is a much stickier problem. I definitely don't have any magic bullets. Um, I mean, I think the main thing is actually, because of COVID and then the rise in telehealth, yeah, if you're in suburban Los Angeles and there isn't a child psychiatrist in Los Angeles, there are other cities in California. There are psychiatrists that are equally busy, but you just never know who's going to have an opening when. And so I've gotten requests from parents in the San Francisco area to see their kids. And yeah, as long as it's not an untenable situation, then I'm happy to do it. And whether it's down here at UCLA or USC or up there, UCSF or Stanford or some of the other, big academic medical centers or just big care groups, then oftentimes people can find something. It might not be available right away, but at least be able to find something.
And is there a website that parents can go to start for a search?
So the ACAP website, the American Academy of Child and Adolescent Psychiatry, has a directory nationally for child psychiatrists, so definitely there. For therapy, certainly for anxiety, there are similar things. So there's a website for parents to find CBT, cognitive behavioral therapy, and the website is findcbt.org. And so if a parent, say lives in Santa Barbara or Orange County and somewhere where I don't know who the therapists are, then I'll say findcbt.org. You can search by your zip code, and anybody who you would find on that website is probably somebody I would recommend anyway.
Thank you, Carl.
Yeah.